The ability to visualize your anatomical structures and understand what's happening with your body physiologically while you stretch is the key to achieving an optimum stretch. Today I'm going to walk you through some basic neck and back stretches and talk about what's happening underneath the skin and talk about what breath actually does for a stretch and how minute movements and slight changes can affect the way a stretch resonates in your body on a profound level. This first stretch that I'm demonstrating here is for the lateral neck and the shoulder. And what I want to impress is that as I let my left shoulder drop down, I'm not pushing it down, but I'm letting it be heavy. And those are two distinct things that I talk about with my clients on a daily basis. When I ask a client to let go or relax, oftentimes it triggers this need to push down as opposed to let go. And those are two very different things. Pushing down contracts muscle tissue, and letting go lets that muscle tissue go, and that's the key. Demonstrating this same stretch on the opposite side now, I'm going to talk about what's happening anatomically and physiologically. Depending on the angle to which I tilt my head and the depth to which I stretch, there are at least 10 to 15 muscles of the head and neck that this stretch affects. The number of muscles in the head and neck alone is amazing in and of itself. But on top of that, each one of those muscles has a layer of connective tissue that surrounds the muscle and connects that muscle to another muscle, and then extends down and attaches that muscle onto a bone. On a deeper level, each of those muscles has fibers within the muscle that are then themselves surrounded by connective tissue, which also extend down and attach onto bones. With this stretch, as I'm letting my shoulder drop down, I'm slowly going to turn my head, and one of the visual cues I like to use is to think about pointing my nose down to the floor or up to the sky, and each of those slight movements affects a different layer of connective tissue and affects a different area of muscle that doesn't exist in a vacuum. They're all connected, they all play a role with each other, and as I turn my head, that becomes very evident. The interconnectedness of the shoulder and the back and the neck is not something to ignore. And so when there's pain in one of those areas, it benefits us to really pay attention to all three. So with this stretch, I'm deepening the same lateral neck stretch that I just did, only this time I'm manipulating the shoulder so that all the muscles involved have a chance to open up, not just in the belly of the muscle, but also at its origin and insertion on every bone that it's attached to. So after I've centered myself and engaged my core, I'm going to take one hand behind my back and use the other hand to pull it away and down, so that in this instance my right shoulder is being pulled down away from the right side of my neck. So more specifically speaking, muscles like the levator scapula and the trapezius that are attached to the spine and the scapula and bridge that whole area start to become lengthened, not only at its spinal attachment but also at its scapular attachment. I'm sure you've seen this stretch for the rhomboids a million times, but I'm going to talk about the importance of breath and how with this simple stretch, breath can enhance and increase the stretch to actually be more effective and have a longer lasting effect than you might have experienced in the past. Taking a deep breath in any stretch is going to bring our awareness to what we are actually feeling, and oftentimes what we're doing is forcing ourselves into a stretch as opposed to letting the stretch just be. It's really easy in the stretch to feel the need to shrug your shoulder up towards your ear or grab your fingers into a fist so that you're ultimately using way more energy than you need to, and that stretch is not settling in as deeply as it really could. Societally, we tend to be short breathers, so when we're stretching and we start to train ourselves how to take a deep breath, we're increasing our oxygen intake, which is how muscles get their nutrients, and therefore how muscles can begin to heal. The front of the neck so often gets ignored, but it's home to a lot of muscles that play a role in some of our most essential elements to who we are. Our larynx, our pharynx, our esophagus, lymph nodes, blood flow, and the list goes on. A lot of these muscles actually attach either to the sternum or the clavicle or the ribs and go all the way up to the hyoid bone, which is the anchor for your tongue. So my focus here is to get all of that connective tissue to release. I'm going to hook one of my hands right down at my clavicle or my sternum or right at that juncture, and I'm going to tilt my head slightly back and to the side and lift my chin, and as I do that I can feel that stretch going all the way down the front of my neck. On the other side, stretching out the back of the neck is another simple stretch that we've all tried, but here's a couple of clues to enhance that stretch. As I lift my hands up and use my hands to slowly pull my head down, I'm not bending at the waist here, but I'm thinking about tucking my chin to my chest and visualizing each of those spinous processes coming out from the back of my cervical spine and gaining space. This next stretch is a little bit tricky, but I offer an alternative just following this, so hang tight. This is one of those stretches that I learned in yoga, but the science of it is spectacular. So as I wrap my elbows around each other, I'm basically placing one elbow on top of the other and then weaving my arms so that my elbows are really pulling my scapula away from my spine. Here in this side view, you can see it a little more clearly. What I'm doing once I've found this position is I'm taking a deep breath in, pulling my back away from my elbows, pulling my elbows forward and then up so that I'm creating a space between my elbows and my chest. As I hold this position, the deep connective tissue all along the lamina groove in my spine and those tiny intercostal muscles between my ribs are starting to loosen their grip and let go. If that last stretch is a little bit tricky, try just grabbing your elbows with your hands and mimicking that same motion, pulling your back backwards, pulling your elbows forward, and creating that space. Anytime you hold a stretch for a long time, and I'm talking about over a minute, not only are you breathing and becoming aware and starting to really release and let go, but on a microscopic level, the collagen fibers that are in your connective tissue that are the ones that are responsible for being more plastic and creating scar tissue will start to liquefy, will start to melt. And those deep stretches that you feel after that minute of holding it is because that layer of connective tissue that felt so restrictive before is finally letting go and allowing for more freedom. Thanks guys, thanks for watching, thanks for subscribing, thanks for all of your support. And I hope that you can use this for yourselves, for your clients, and for whatever else you might need. I hope you guys continue to grow and to challenge each other and to thrive as massage therapists.